Dr. Schroeder, it's great to be here with you, and congratulations on wrapping up the uh, the first coach engagement for you here. For starters, would love to hear your name, where you live, and your specialty and role today.
Yeah, Andrew Schrader, in vascular surgery in Omaha, Nebraska.
Okay. And Andrew, what did your life look like before coaching?
Um, there's just a lot of uncertainty, I'd say, and some self-doubt. I think, just being new, a newer physician, and you know, a challenging specialty, but yeah, just some uncertainty about where things were going and what I really wanted. So.
Okay. And I guess with that uncertainty and with that self-doubt, which comes up a lot, for surgeons and for early career attendings, how did that make you feel and what were you unable to do that you wish you could?
Um, Yeah, I mean, I felt like I wasn't sure if I could really cut it, really feel like, I could really do this. And yeah, yeah. So, you know, there's it's not productive to a healthy work environment for sure.
Yeah. And did that have an impact on your life outside of work or other people around you?
Oh, definitely. Yeah, I mean, yeah, I was starting to have some trouble sleeping, just kind of a lot of worry, a lot of fear in some respects. Um, and yeah, I think my relationship suffered as well with that kind of inability to turn off. So
Got it.
definitely.
Yeah. I think a lot of physicians can relate. Um, and moving kind of from that reality to where you are now, how did you find us or find out about coaching and what were your thoughts going into the process?
Yeah, I mean, I've done some coaching in the past, and then this is actually just an email that came across, and I've been kind of like thinking about it for probably a couple months, and the email came across, and I was kind of like, you know what, I think I would like to reach out and see about some ongoing coaching.
Yeah. And I guess what were your doubts and fears going in and what made you say yes anyways?
Is it really going to help? Is it really you know, do I really need it? Um, Cost, of course. And then I went and went for it because I felt like there wasn't much downside really. And it seemed like Gail and her team had a lot of experience in the field, and especially with physicians. And I think that's something that's hard to find a lot of times. I
Yeah.
actually kind of reached out I kind of reached out locally and hadn't really gotten very far with anything here locally. So yeah, kind of made sense to give it a shot and go forward and see if I was a little uncertain about the virtual sort of setup of it, but I think it's really worked out well, and really just to have people that are experienced and coach so many other physicians and surgeons was really helpful.
Definitely. And when you talk about it working out well, I mean, where are you now? What are the benefits you've seen and what are you able to do now that you really couldn't do before?
Yeah, I think I'm much better at kind of compartmentalizing work and away from work and just sort of not taking as much home emotionally in a lot of ways. And yeah, and just I don't know, a little more confident, I guess, in my abilities and in my training and what I know and what I can do and what I can't do, what I do need to ask for help for maybe. And yeah, so I think that just helped me sort of recenter and refocus on what I know and what I know I can do, and then stick to that. So.
Yeah. And you kind of talked about this having an impact on your relationship, your, ability to show up as a dad. What have been the positive benefits there outside of work?
Yeah, definitely. I mean, so that kind of ability to, leave work at work a little bit more, be a little more present at home. I'm certainly not perfect at it. I got to keep working on it, but yeah, I mean, it's been a big change, and then
Wow.
certainly sleep and things like that have been a big change too. So
Yeah.
yeah,
That's great to hear.
yeah.
Um, and last question, what would you tell someone who's watching this right now and they're maybe not sure about taking the next step?
I just say go for it. You don't have much to lose. I think that yeah, it's not going to hurt anything, certainly. And the benefits are huge. I mean, just to have people that are so experienced in doing this, and
Yeah.
just a really experienced person to bounce ideas off of and things like that. So I think it's really worthwhile.
Yeah. Well, appreciate your time. Really happy that we were able to serve you and look forward to helping any physician who's watching.
Yeah, for sure.